Well, welcome, good evening everyone. Welcome to our annual general meeting, NHS Devon CCG. Thanks for joining us. I hope over the next few minutes we'll get a chance to share with you some of the things that have been happening over the last year, some of the things that we face over the coming year, and for you a chance to ask any questions that you have. My name is Paul Johnson. I'm a local GP and I'm clinical chair of the CCG. I'm pleased to be joined by Simon Tapley to my right. He's our Deputy Chief Executive, but was also our Chief Executive for the year up to the 31st of March 21. So he was Chief Executive during the year that we will be looking back at. So as I say, firstly, we'll be looking back. There'll be some things that we have achieved as an NHS system for you, the population of Devon, but particularly we'll focus on how we've had to respond to the coronavirus. And then let's talk a little bit about our future plans, about how we need to improve the health and care to you, our residents, to our local population. If you want to ask questions, there is the tab on the right-hand side. So please do use that to submit questions. We'll try and get through all of them. We'll answer them at the end of this brief presentation, and any that we can't provide the answers for now, we'll certainly take away and make sure that we follow those up. If you go to our website, devonccg.nhs.uk, you'll be able to see our annual report, which goes into more details, some of the things that we'll be touching on today. Simon, over to you.
Good evening, everybody. So as Paul mentioned, my name's Simon Tapley. I'm the CCG's Deputy Chief Exec. We thought it'd be useful to just tell you what CCG is, so a clinical commissioning group. So we're the headquarters for the local NHS in Devon. We have a budget of about £1.8 billion annually. Our role is to plan future services and how they can best be delivered to improve the population's wellbeing, health and care. And we have a population of about 1.2 million people. We are a membership body that's made up of all of the 123 GP practices in Devon and are led by a governing body of healthcare professionals, including local GPs, nurses, consultants, therapists and lay members who ensure that we commission safe and effective healthcare services. On the 1st of April this year, we became an integrated care system after several years of preparation. The ICS brings together all of our health and social care partners in the county, and we will work with local communities and voluntary sector to improve care for people. We'll talk more about the ICS and our future plans later in the evening, but first, just like to share with you a short video capturing some of our highlights and achievements over the past year.
We established new processes really quickly and efficiently, including sort of systems of stores and ordering and logistical movements of PPE all around Devon. We did it with the patient in mind, and that the safety of the carers was the forefront of our thinking.
They've produced a very sophisticated and accurate model of the situation and how it progressed, and was able to articulate something that was very complex in nature in a way that was immediately accessible to people and clear.
see this way of working for the foreseeable future. By that I mean remote consultations being the norm.
The team have been absolutely pivotal over the past couple of months, supporting us as CCG staff, as well as our GP practices to care for local people.
It's a really important report, and congratulations to the NHS in Devon for the initiative to commission it. More importantly, I think that we've done quite a lot to ensure that the recommendations, there's a clear action plan for implementing the recommendations.
Shouldn't be limited by your own imagination, but be inspired by other people's achievement. Well, I am certainly inspired by all that you've achieved. So keep it up and keep the work going for us all. Thank you.
Well, the coronavirus pandemic has touched everyone's lives. It's been one of the most challenging periods for our NHS in Devon and for people personally. Before we go into the details of what we've done as an NHS, let's just pause for a moment, because there are people who have lost their lives and there are families who have lost their loved ones. So let's take a pause and think of them. In some ways, we have been more fortunate than other areas here in Devon, because our number of cases have remained relatively low compared to other areas in the country. And although they have been generally lower, we've still had to make plans, and we've still had to change the way we deliver services so that we do things that are safe and appropriate for our population, and so we can treat people with coronavirus, but also maintaining those emergency services that people need. Working together as a system, that's the NHS, the local authority, the police, public health departments, our care homes, volunteers, we've been able to ensure that people can still get the care they need when they need it and in a safe way. We're also really grateful for local people for their help in reducing pressures on our services. The people of Devon have done incredibly well by following the national guidance, making sure they follow those simple steps of washing their hands, staying at home when asked, and maintaining social distancing. So we thank you for doing that. Now, as the video showed, despite the challenges of the past year, we've achieved a great deal that we should all be proud of in Devon. So first of all, I want to say a huge thank you to you, the people of Devon, for your extraordinary efforts. Everyone has come together to support the cause, and we've been truly humbled by the great community spirit. Our GPs have done tremendous work, and we've been greatly supported by businesses, by councils, by community groups, not to mention the army of volunteers who have helped staff our vaccination centres. The vast majority of local people have shown great care to prevent the spread of coronavirus, observing the rules and making sure that we all keep as safe as possible. With all this help, we've achieved tremendous results with the vaccination programme. Since this lady, Kathleen Viney, has became one of the first people in Devon to get vaccinated way back on the 8th of December, we've given 1.5 million vaccines to local people. And of those, more than 830,000 people have had their first dose and 650,000 have had their second. We can put that another way and say that 8 in 10 adults over the age of 50 in Devon have now had their first dose, and more than 6 in 10 adults have had their second. As of late June, we're now inviting everyone over the age of 18 to book their vaccination. We're hugely grateful for the great variety of support we've had in setting up the vaccination centres so that we could work as quickly and as widely as possible. Plymouth Argyle, for instance, have been supporters from day one, and the Exeter Chiefs also helped build our Nightingale Hospital, along with the Army, with Network Rail and many others. It's been so heartening to see that people in Devon understand that our best chance of beating COVID-19 is by us all getting vaccinated. Of course, we've needed to pay special attention to groups that may need more support or more encouragement. We'll come to care homes later, but supporting them was a huge priority to make sure that their residents were kept safe and were looked after. And also, because not everyone in our communities has a computer or a tablet where they can get information, we've made sure that they've had access to printed newspapers, with over 300,000 of them being produced, so that they could reach some of our remote and isolated communities, so that we can make sure they get the information they need to help them manage themselves in this pandemic. We've also done lots of work to involve and understand the thoughts and concerns around vaccination among people from Black, Asian and minority ethnic backgrounds. Many people from these backgrounds are at higher risk of severe illness and complications from COVID, so this is particularly important. The picture that is coming onto your screen now shows our staff going to the Exeter Mosque to carry out vaccinations there with the full support of the Imam. And now a short video of the work that we did with the Exeter Mosque. Which will hopefully come onto your screen shortly.
Islam obligates us to preserve lives. Our beloved Prophet Muhammad, peace be upon him, he said, "O servant of Allah, so you seek treatment to cure from illness. For Allah, for God, he does not create any disease except that he creates a cure for it."
Well done. All right.
Not to any pain, no nothing. Easy, very easy. My opinion is everyone need to get attention.
So I believe that there is no doubt it's an obligation and moral responsibility for each and every one of us to take this vaccination to protect our life and to protect the life of those around us. Cedar Mosque and Cultural Center has been working closely with the NHS Devon to encourage our brothers and sisters and to give them real information to have their vaccine.
So alongside our vaccination programme, we've also continued to care for people with coronavirus. Our whole health system has risen to the challenge, and the amount of planning, change and innovation has been extraordinary. This included the planning and building of the NHS Nightingale Hospital in Exeter, which was designed to treat COVID-19 patients and help reduce pressure on our existing hospitals. While the coronavirus cases were lower in the summer, we were also able to use the hospital to provide thousands of diagnostic tests such as CTs and MRIs, ensuring people could get the care they needed. Because our levels of the virus have been lower, we've also been able to help out other areas by making beds available, not just to patients in the southwest, but to other parts of the country that were especially hard hit. We know that they would have done the same for us if the situation had been the other way around. So in partnership with our local authorities, we've been able to support care homes. Our care home residents and staff across the country were faced with some of the greatest challenges through the pandemic. They are some of the most vulnerable in our community, and I know the restrictions to visiting arrangements, whilst necessary, were particularly difficult for residents and their loved ones. I'm extremely proud of the work our staff did right from the start of the pandemic to make sure people in our care homes were kept safe. Colleagues worked relentlessly to make sure that care home staff knew everything they needed to know, how to use protective equipment, best practice in infection control, when and how to do testing and so on. And of course, once we got the vaccination, we continued to support the care homes. You may remember that the first vaccine available was Pfizer, which presented some real challenges in terms of storage and transport. But we offered all the staff and residents in care homes the vaccinations in very short order, thanks to the commitment of our staff, our GPs, and with the support of our local authority colleagues. One of the most cruel things about the pandemic is that it has made life so much harder for those who already struggle. Lockdown, isolation, uncertainty, worry about income or family stress, they've all had a very negative impact on people's mental health. As with other clinics, we've made sure people continue to get access to mental health help, support and care. Some of our residential units had to slightly reduce bed numbers to ensure social distancing. Red Hills House, for instance, was carried on providing care for people who need short stay in a unit but don't need to go to the hospital. We've also brought forward some projects, including a 24/7 first response service, so that people who are struggling can get immediate support and be directed to the most appropriate place to get what they need. Throughout the past 18 months, we've been very mindful of the pressures our staff are under and the impact of remote working. To support their wellbeing, we've put in extra measures, including holding a fortnightly webinar to update staff on latest news, as well as highlighting positive stories, running wellbeing check-ins with all our staff to see how they are coping and what support they require, organising various wellbeing courses, including yoga, exercise and mindfulness. We know that the pandemic has meant that more people need mental health support, and for some the true impact may not manifest itself for years. We therefore need to plan for the future to make sure people can get the help they need in a timely way.
The pandemic has also led to a change in how people interact with their GP practice. Many people are now able to use online consultation and other digital services, and as well as enabling people to contact their practice outside of normal working hours and saving unnecessary trips. It also helps our surgeries to make sure that they can see the people who really need to be seen face to face when they need to be seen. General practice has been able to provide more care than ever before. With over 2 million telephone appointments and 500,000 online consultations, as well as 4 million face-to-face appointments. As a CCG, we've helped practices deliver more of those online services by providing hundreds of additional laptops to them and giving them the support to stay connected. It's a similar story for clinics in our hospitals too. There will always be people who need to be seen in person, of course, but technology is now advancing so rapidly that consultations can more and more often be done at a distance. For patients, That means time, money and miles travelled saved, not to mention being able to park and access your clinics. The pandemic has had negative impacts beyond just the virus. It's led to an increase in waiting times for outpatients and for planned operations across the country, and it will have been really tough for those who need to be seen. So we're doing everything we can to treat people as quickly as possible. This includes putting purpose-built theatres into the Nightingale Hospital in Exeter, so that orthopaedic operations such as hip and knee replacements can be carried out there. There'll be ready-made units going into Derriford Hospital in Plymouth for cataracts and for eye procedures, and we're looking at converting some of our existing facilities to do this in other local areas as well. We're also going to be making full use of our independent sector colleagues so that they can help us to clear the backlog and the waits as quickly as we can. We're doing everything we can. So we are in a much better place now with COVID-19, but we're not out of the woods yet. We saw from the government decision last month to delay the final lifting of restrictions that the situation can still fluctuate and change, and new challenges can still come our way. So I would like to urge everyone to carry on as they have been, keeping that social distance, wearing a mask where appropriate, washing your hands, and most importantly, of course, the thing that we can do to protect ourselves and our loved ones and get back to normal as quickly as possible is to get vaccinated.
So while the coronavirus pandemic has rightly demanded a huge amount of our focus and effort this year, we've also seen lots of innovation and good work in other areas too. So we're really pleased that earlier this month, work started on a brand new health and wellbeing centre in Dartmouth. The centre, which is due to open its doors in late summer 22, will give local people access to a broad range of health and wellbeing services in one place by bringing together GPs, community nurses, therapists, Dartmouth Caring and a pharmacy. Using national funding, we've improved facilities in our hospitals as well. In Plymouth, for example, that's urgent care services in a completely revamped department, including a separate urgent care area for children. We've had good results in promoting the Think 111 First campaign, which encourages people not just to turn up at A&E, but to make a call to 111 first, so they can be directed to the most appropriate service for them. We've opened a new place of safety for children so that young people having a mental health crisis don't end up in either A&E or in a police station, but have proper care in the right setting. Also, the One Northern Devon project has gone from strength to strength. It sees the NHS work as partners alongside their communities, councils, community organisations, the voluntary sector, social care, mental health on a town-by-town basis. Among the project's achievements is the High Flow project, which provides personalised and holistic support for people with highly complex and multiple needs. As well as better supporting people, the project helped reduce demand in the system with 70% reduction in A&E attendances for the participants and a 9% reduction in days spent in hospital. Improving experiences for Black, Asian and minority ethnic staff and communities has been another key area of focus, and you heard Lincoln talk about that in the video that we saw earlier. Last year we carried out 3 months of involvement work with communities to understand their experiences of health and care in Devon. From this, we published a hard-hitting report last month that includes many recommendations and an action plan which organisations across Devon have adopted and begun to implement. I'd like to thank everyone who was involved in this important piece of work, including the staff and teams who coordinated it, and especially the people that shared their views with us.
We're delighted that Devon has become an integrated care system. What this means is that we will now work much more closely with our 3 local authorities and with our colleagues in health and care, such as the hospitals, mental health providers and our GPs. And to do this, we will then be able to provide more joined up care for you, our local populations. In April this year, we were pleased to welcome Jane Milligan as the Chief Executive of the Integrated Care System, as well as the leader for our CCG. After originally qualifying as a physiotherapist and learning her trade here in Devon, Jane has a very strong background in commissioning and in collaborative working, so we are delighted that she has become part of our team. We need to work together because we've got very significant challenges. We know we're spending more on healthcare than the allocation that we are being given. Our GPs and emergency departments are busier than they have ever been. People are waiting too long for care, and in some cases having to travel out of the county to get that care. And this has been made worse during the pandemic. We need more doctors and nurses and health visitors and social workers and therapists in order to provide the care that we all expect. The future need to protect beds for routine planned treatment in the face of increased usage for emergency purposes gives us a real challenge. And we need to reduce health inequalities which have widened during the pandemic.
In the integrated care system, we'll need to take joint action, and this will be set out in our long-term plan. By working together, we can ensure the care we deliver is coordinated, well planned and joined up, so people don't have to tell their story multiple times. Over the coming months, we'll be talking to local people as we draw up this plan, but the priorities are clear. We will support the health and well-being of staff and take action on recruitment and retention. We will deliver the COVID-19 vaccine programme and continue to meet the needs of patients with COVID-19. We will build on pandemic learning to transform the delivery of services, accelerate the restoration of elective and cancer care, and manage the increasing demand on mental health services. We will enhance community care and general practice to improve access, local health outcomes, and address health inequalities. We will transform community and urgent care to prevent inappropriate attendance at emergency departments, improve timely admission to hospital for patients, and reduce the time spent in hospital. We need to change the way services are delivered so we can continue to meet people's needs. The pandemic has shown that technology will play a vital role in providing people with quicker and more convenient care, and that we will continue to develop this. We need to make sure our system is resilient, which may mean our hospitals specialise more, but all services will still be within the county. People have told us that they're prepared to travel for prompt, safe services. We're supporting people to look after themselves better and to come to us when they need to, or to have us come to them in their own homes. And we need to make sure we have the services required here in Devon so that we don't see people, for example, with autism, being placed miles away where it is difficult for family to visit.
Without doubt, this past year has been hugely challenging, but it has brought partners and communities across Devon together better than ever before. As you've heard tonight, there have been some fantastic innovations too, which we'll continue to build on in the months and years ahead. So I hope this gives you a brief summary of the challenges we faced, the things that we have done to meet those challenges, and what we need to do in the year ahead to continue to care for you as the NHS in Devon. Thank you. We've got a few minutes for questions. We had one question submitted beforehand, and I'm going to, Simon, if I can just summarise this question, and then there's another one that has come through whilst we've been doing the meeting. So the summary from this, and it's from Elizabeth McElvery, and it is really about out of hours provision in the community. And it's that she's getting reports through about the length of time patients having to wait for callbacks and for ambulances, and whether medical staff are available to advise or see them, particularly in out of hours. And I think there's a challenge for us about what we're doing to ensure that that out of hours offer is robust and is meeting people's needs.
Yeah, so thank you, Paul. So I think urgent care services in Devon, as they are across the country, are really stretched at the moment. We've seen a 25% plus increase in GP practice demand. we've seen a 25% increase in ambulance activations, which is the highest in the country for in the southwest. So we're working with Devon doctors who are out of hours and 111 provider to try to work on increased workforce and recruitment and retention. We've put some additional money in, but we are also collectively working with our colleagues in general practice and in our hospital settings to try to make sure there is a more robust offer. So I'd acknowledge what Elizabeth has asked of us, and we are working very closely with our provider to try and solve those issues.
And I think it's important to stress that the staff, the clinical staff who are providing those services, they've worked throughout the pandemic. We know that our staff are tired because of all the extra that they put in and needed to put in. And we also know that a number of staff will be having to self-isolate, particularly as the amount of infection is increasing the same way that everyone else is. So that's impacting on the availability of those clinical staff to meet those needs. So we've got to make sure, and we are supporting them rather than just because of that situation as well.
Yeah, agree.
The second question is from Tim Saunders, and he wants to ask about diagnostic services for ADHD and autism, and he's talking particularly in Plymouth, but then there may be some consistent messages wider than throughout the county, and two parts. And he says, I understand that the CCG recently commissioned a report into the state of diagnostic services for adults with ADHD in Devon. Please can you confirm that this is the case, and if so, how can the public access the report when it's completed? And then the second thing is, he says, I understand that diagnostic services for adult ADHD and autism in Plymouth have not been functional for some time. And please could the CCG explain what they are doing to rectify the situation, projected timeline for improving the service?
So I'll need to get back to the questioner about we have done an internal review of the services around autism and ADHD assessment, and that was done a while ago. Now I'm not sure about the formal report, so I'll need to look into that. We have provided some additional investment, and we are working with both our providers in Devon and in Plymouth to try to improve those, because we can see that the waiting times are much longer than we would expect to see. But I will have to get back to the questioner with more detail.
Okay, and we do have his details because I know that he has contacted, he's emailed the CCG, so we'll make sure. So Tim, if you are listening, we'll make sure that we get back to you. That's all the questions that we have. So I guess it just comes to me to say thank you once again for listening, for tuning in. Thank you for all that you have done in doing the right, do the right things to look after yourselves and to stay safe over the course of the last year. And I'm confident that we as a community in Devon will continue to do so. So I would like to thank all of our partners and local communities for everything they've done in the last year. I'd also like to particularly thank our CCG staff for being so dedicated, adaptable and supportive, and we really wouldn't have been able to achieve what we have without your support. And particularly to thank Simon, who stepped into that role as in leadership for the CCG and led us through what has been a really challenging year. Please do visit our website to find out more information about the CCG and our latest projects. And all that remains for me to say is thank you for joining us and have a good evening.